Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Diabetes present in the adults, and we're looking at the treatment goals. So there are some factors such as the clinical findings, HbA1c. This should be less than 7%. Then the preprandial capillary plasma glucose. So the preprandial capillary plasma glucose. So this should be 80 to 130 mg per dl. Next, what is involved is the peak postprandial capillary plasma glucose. So peak. So preprandial. Now this is going to be postprandial capillary plasma glucose. So this is nothing but less than 180 mg per dl. Next, we look at the blood glucose. The blood glucose will be less than 140 by 80 mmHg. So some important things to note is that the diabetic associations, it recommends the HbA1c of less than 7%. So less than 7% is seen in most patients. So it is less than 7%. And talking about the BP, blood pressure, and this is as per the ADA, they recommend a target blood pressure of less than 140/80. That is in patients with associated diabetes. So in diabetic adults. And if the patient, it adds on for the younger individuals, it should be, in the young, it should be nothing but less than 130/80. So this is seen in terms of young individuals. Next, there is a AHA sprint trial recommendations. So there is also something known as the AHA sprint trial. So as per the AHA sprint trial associations, so trial recommendations, so here the goal of the blood pressure in patients with diabetes mellitus should be brought less than 130/80. And the unit is always mmHg. Then last, a note on the dyslipidemia. So in terms of the dyslipidemia, there is no particular treatment goal, but the ADA. So what does the ADA recommend? The ADA recommends a lifestyle therapy. So there is a lifestyle therapy which is to be done in these patients and who have elevated triglyceride levels. So they have a elevated triglyceride levels. So this is followed in patients who have greater than 150 mm per dl, that is 1.7 millimole per liter, and also the low HDL cholesterol, that is low HDL cholesterol. So this is nothing but less than 40. This is less than 40 mg per dl. This is considered in terms of men, and it is less than 50 mg per dl, and this will be considered in terms of the women. Now, when you look at the treatment with the statins, so there is always treatments with statins. So this treatment should depend on the CVS manifestations, that are cardiovascular system risks, rather than only focusing on, so this is the ASCVD, rather than the, so this should be the main focus rather than the LDL, HDL, cholesterol level. To learn and grow daily like this, please do subscribe.